been an active and enthusiastic participant at the International Anniversary Conference marking 35 years of the Declaration of Alma-Ata. Greece have grasped that opportunity and is putting primary health care now more than ever into practice, notwithstanding the extremely difficult crisis context under which we operate in a country where primary care has over the last decades been virtually eclipsed by poorly regulated and wasteful overconsumption of specialist care. But what has Greece been able to do over the last 10 months after the Alma-Ata conference is very interesting. As starting point, the Greek Parliament has passed, against strong opposition of various interest groups, the so-called PEDI law. This is the National Primary Care Network law, a law instauring a unified primary care system. Its effects will play out over time, but there are already important concrete results around three axes. First, is moving towards universal coverage. At the beginning of 2014, nearly 1/4 of the Greek population, including most of the poorest, faced unsurmountable financial barriers to access to care. From February on, they have gained free access to primary care consultations. In June, they became entitled to hospitalizations to public hospitals and then to medicines, including the ones for chronic diseases, all under the same conditions as the insured population. Things are not perfect yet, but the situation where a large part of the population had no access at all is a thing of the past. Second, Greece is moving towards people-centered care by creating a network of family health units as the entry point for better quality care. Greece presents the paradox of having one of the highest doctor-population ratios in the world, but at the same time having almost no family physicians, with all the consequences in terms of continuity, coordination, and critically people-centeredness. Everybody knows that building the network and culture of family primary healthcare units will be a long-term process, but it has now started and it is gaining momentum. Third, the transformation into a primary care-based system has allowed Greece to revitalize the ongoing for 3 decades mental health reform, including the closure of the psychiatric asylums of the past within 2015, because the law provides Greece with one of the missing pieces, the primary care system in which to integrate community mental health services. Greece has taken the call for primary care now more than ever and shows that even in difficult circumstances this can be done. Thank you for your attention.
Thank you, Greece. I give the floor to the delegate of Denmark to be followed.